To talk about personalized medicine, we need to go back to an international project called Human Genomic Project, which was started in early 21st century, and actually is an ongoing project where we now manage to map human DNA. Now, what happened during this project in 2011, as a part of this project, they've tested DNA and mapped DNA of identical twins to find out that the DNA is not identical. Everyone was expecting that it'll be identical. And at that time, they found out that there are small, like micro mutations in the DNA that makes it different in each person. Now, from this discovery, we moved to testing those micro mutations. They are called single nucleotide polymorphism. Now, those micromutations do not impact on functioning of our body because the nature allows some imperfection. But what it does, it impacts on how the medication is able to bind to a receptor or work on a receptor. So if you imagine for the medication to be able to fully work on the receptor it's like a key and keyhole. They must match perfectly. Now, if the person has this micromutation, the single nucleotide polymorphism, in the part of DNA that actually is coding how the receptor looks like, this medication is not going to bind to it, or is only partially going to work on this receptor. And therefore, what we able, since really 2018, what we able to test is we are able to test those small mutations in the DNA to see which medication the patient is not likely to respond to, and which medication the patient is more likely to respond. I think the important part of the personalized medicine is to understand that it is just a part of how the medication work on our body or in psychiatry, on our brain. So it doesn't give us, unfortunately, 100% accuracy or what we should prescribe or what we shouldn't prescribe, but gives us about 80% of accuracy in prescribing, which in psychiatry is very important. And the reason why it is important is that really in psychiatry, we do not have any other tests that we can use. So if you imagine going to the doctor, having a blood test, they can find that someone has low iron levels, they prescribe iron, they retest, and when the iron levels are fine, the person's cured. Up to pharmacogenomic testing, there was not a single test in psychiatry we could use to establish which medication is going to be effective for this person or is going not to be effective. The pharmacogenomic testing is quite simple. It is just a mouse swab, which the patient can do in the clinic or can do at home. It doesn't require any special knowledge. There is a very straightforward, simple instruction how to do the swab. The person is asked not to eat, drink, or smoke for a period of time before obtaining the DNA. And then the sample is put into the envelope and posted to the company that provides the test. Interestingly, these tests are done, there are quite a few laboratories which start doing those very similar tests. The most accessible from the UK is actually the laboratory in United States. And that is because of having a representative in the UK who can have license to transport biological material. So the test takes about 10 days for the results to be obtained. One important information is that the patient, when they are taking the test and sending them to the lab, they need to have a doctor who approves this test. This is due to the American law. Pharmacogenomic tests are licensed by Food and Drug Administration as medical tests, and therefore they require requisition form from a doctor. Now, once the results are received, and they are received not by the patient, they are received again by the doctor. That's the American process. We meet the patient and go through the details of the results, discussing which medication are mostly likely to be effective for them. Looking at the dosage, there is also quite an important part of this test, which looks at liver enzymes, as majority of medication is metabolized by the liver, so it's broken down by the liver. And the tests also give us indication which medication will be broken by the liver in a normal way, which medication might not be broken down by the liver as fast as expecting. So the patient will require lower doses, and which medication will be actually quite quickly broken down by the liver, where it's not likely that low doses of this medication will be effective because it'll be gone before it actually takes any effect on the brain. So based on those two information, so obviously the information's about the receptors in the brain and then information about the liver, what we do is advise patients of the most likely medication that should be effective for them. I think one more thing to say, this pharmacogenomic test also looks at some potential side effects of medication. It is mostly the risk of psychotropic medication induced weight gain, which is quite important because people don't want to uncontrollably gain weight on those medications. And also it gives us some indications about things like skin reactions, etc., to certain medication. Talking about benefits of pharmacogenomic testing or personalized medicine, obviously we are, with use of this type of testing, we are more likely to advise the patient which medication and which dose of medication is mostly likely to be effective for them. I think it's worth mentioning that one of the studies done in America, which was used to actually license the test with the Food and Drug Administration, was looking at the effectiveness of treatment of patients with the first episode of depression. And they had two groups of patients, those who had the pharmacogenomic test and a group of patients who haven't had the pharmacogenomic test. And in the first group, the patients that did not have the test, the accuracy of prescribing, meaning that from the very start of first contact with the psychiatrist, they were prescribed right and effective medicine for them for the first onset of depression. There was about around 40% only who did not need change of these medications in the nearest future because the medication was not effective. In the group of the patients where the test was completed, the effectiveness of first-time prescribing for depression was 80%. So the definite benefit of the test is 100% increase in accuracy of prescribing, if that makes sense. There are some other benefits. I mean, because it's a DNA test, the person doesn't need to repeat it ever. It's one-off test, and it is valid through the lifespan. Then obviously it's simple, it's mouse swab, so it can be done from the comfort of our own home. And it's obviously painless, which is another benefit. In terms of drawbacks, yes, there's few. It does not give 100% accuracy because our DNA is only responsible for how we are born, but then any developmental changes might also impact on prescribing or effectiveness of the medication, and therefore it doesn't give us 100%. I think also the methods has been so new that we still learning, and in my practice, I've been using pharmacogenomic testing since 2019, so about 6 months from the time that it was first available in the UK. Even the results are changing because we're learning more about the impact. So the test is getting more and more accurate. And I think the last disadvantage is obviously price. The test costs over £700, and it's not available through the NHS. So that's always a little bit of a problem for the patients to be able to pay this amount of money.